It's your chance to ask anything of the doctors tonight on Call. Funding for On Call television is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call television as it continues to open doors for important medical information. And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding is provided by Dakota Care, the Brookings Health System, Dr. Mark Bubach with Dakota Allergy and Asthma, Dakota Dermatology, Aberdeen Asthma and Allergy, the Orthopedic Institute, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation. It is time to let you at home pilot our show. Call in your questions on whatever health topic you want, because it is Ask Anything when the doctors are on call tonight.
Hello and welcome to On Call Television. Tonight's topic is whatever you want it to be. It's an Ask Anything show. Ask about a new medical treatment you've heard of, or ask about sexual health, or ask about that itchy rash on your bum, or ask about anything. This is a no-holds-barred show. If you have a question and you can stump these stars, I challenge you. And to those who have called in before, thank you. It helps. Do it again. If you've never called in before, give it a try tonight. 1-888-376-6225, or email us at questions@oncalltelevision.com. With us this evening to answer your questions about anything and everything are experts. Dr. Kim Wilde, a general internist from the Brown Clinic. A general internist knows everything about everything. And also Dr. Aaron Shives, a general family physician from Watertown as well. He knows even more than Kim Wilde. I mean, these guys know, this is the group. And so I challenge you. Bring us a question that you will stump us with. Call 1-888-376-6225. To help us get started on our potpourri of topics is our state epidemiologist, Dr. Lon Kightlinger, with an update from the South Dakota Department of Health and a warning about a growing danger that's returning to our state.
Good evening, Dr. Holm and the viewers of the On Call show. I'm Lon Kightlinger. I'm the state epidemiologist with the South Dakota Department of Health, and I'm here in Pierre, and I'm giving you a quick public health update. Now we're in April, the winter diseases are ebbing away, influenza and the other respiratory diseases and pneumonias are decreasing. The winter diarrheas are also decreasing, and that is norovirus, what's also called cruise ship virus. Now we don't have many cruise ships that stop in South Dakota, but norovirus hits us anyway. It hits our nursing homes, it's in our schools, and even an occasional wedding reception. The summer diseases are just around the corner, and they also include diarrheal diseases, but of a different sort. Summer diarrheas include Salmonella, E. coli, Campylobacter, Cryptosporidiosis, and our old friend Giardia. West Nile will be showing its face again in South Dakota, we anticipate late June, early July. And this year, look for new and improved mosquito control initiatives in your communities this summer. The ticks are also out. Now, most people find ticks even more disgusting than mosquitoes, but most South Dakota people don't realize that ticks can also cause disease. So please prevent or keep the ticks off of you, your children, and your dogs. And where I live here in Pierre, we also have the annual reawakening of the rattlesnake population, so I have to rejigger my dog walking paths. Ongoing here in the health department, we have the obesity program, diabetes, improving nutrition, tobacco control, blood pressure awareness, and of course the cancer programs. With the infectious diseases, we have many diseases that are up now. We're experiencing a big increase in Shigella, over 450 cases of Shigella in the past 6 months or so. Now, Shigella causes severe diarrhea. It's highly contagious, and it most commonly affects children. So daycares and elementary schools are really hit hard with shigellosis. It can spread like wildfire in a daycare or a school. And prevention is good hand hygiene and scrupulous toilet hygiene. Whooping cough is also up in South Dakota, so please make sure that you and your children are well vaccinated. Hepatitis C is also up in the state, and very disturbingly now we're experiencing a big increase in the STDs, or the sexually transmitted diseases, or as some people call them, the STIs, the sexually transmitted infections here in South Dakota. And these include gonorrhea, chlamydia, HIV/AIDS, and syphilis. For much of the 1990s and the 2000s, South Dakota was considered to be a low-incidence state. We had the diseases, but at fairly low numbers, and some years we didn't have any syphilis at all in the state. But we're now becoming, I hate to say it, but we're on the track to becoming a high-incidence state for these diseases. Chlamydia has been increasing every year after year in the state. We now have about 4,000 cases reported annually here in South Dakota, and many more cases that are undiagnosed, unknown, or unreported. Gonorrhea, in the past couple years since 2008, has tripled in South Dakota. And both chlamydia and gonorrhea, they cause all kinds of problems, including, unfortunately, infertility. HIV/AIDS is also up. Just last year, we had one of our highest years ever with 39 cases, and already this year, as of the end of March, we had 15 cases of HIV/AIDS already in the state. And very, very concerning is we now have outbreaks of syphilis in South Dakota, the likes that we haven't seen for 45 years in the state. So all physicians should have syphilis on their medical radar screens, and all sexually active people should be aware of the disease. They should know how to recognize the symptoms, and most importantly, they should know how to prevent it. And prevention measures include abstinence, monogamy, and condoms. Screening is also very, very important. Syphilis causes sores, it causes rash, it causes neurological problems, stillbirths, and congenital disease. So syphilis puts our babies at risk. So that's just a quick update from the Department of Health in Pierre. I wish everybody a very happy and healthy spring planting and cleaning up season. Thank you.
So Lon gives us a happy bit of advice, and then all of this downer information. I thought that was the most important information, was that terrible news about syphilis. I know that in 2011 there were 0 cases. In 2013 there were like 30 or 12. It was 30, and there was 50 in 2013, and they're already so it's flying through the population. Comments about syphilis. You said that you had somebody.
There was a case that was in Watertown. It was actually oral syphilis that they had caught in somebody that was in a certain occupation, was high risk.
What would be the classic characteristic of syphilis? A sore that doesn't
heal. Painless ulcers.
Painless ulcer. That's
right.
it. Right. A sore that pops up doesn't hurt, so they just sit with it, and then you can spread it. So don't spread it, and don't get it. So, well, we thank you for that update. It's interesting, Shigella, that is one of the bacterial infectious diseases, and there's no good treatment. You just wait it out. If you treat it with an antibiotic, you might cause problems, but it takes like nothing to catch it. I mean, like 3 spores or some darn thing. It's very, very infectious.
Yeah, compared to the other ones, which take thousands of bacteria to transmit, this one takes hardly any. So what he said in that film about good hand washing is the key to all of this. Before you're preparing food, and certainly after using the toilet.
Right, and you know, it's interesting that the respiratory illnesses, if you use this, the alcoholic-based hand thing, it works great, but it doesn't work for Shigella, Salmonella, and for the GIs. You gotta wash your hands.
Right.
So before you work in that preparing food for anyone, you need to do a good hand washing. Take home on that one.
Soap and water for 30 seconds at least.
You know, we've got wonderful questions. Let's just dive right into it. One from Aberdeen. It says, caller has a continuous cough, but her lungs are clear. Could her thyroid medication be causing it? That's interesting. No.
No, no.
Clear cough, what is it likely to be?
Top 3 causes: asthma, gastroesophageal reflux, allergies. Those are the top 3.
Yeah, right, and of course I always think one of those 3 when it's longer than a week and a half, 2 weeks. I mean, the viral respiratory infection will give you a two-week cough after a 1 or 2 day fever, sore throat, and then a runny nose through that time. But if you don't have that and you have scratchy eyes and sneezes, it's allergy.
Another one would be interesting to know if there's an ACE inhibitor like Vasotec and Allopril, those drugs. If they're on that, they could have that cough that just tickles.
That's a really important one. Lisinopril, another one that people use a lot. So if you're on an ACE inhibitor, lisinopril, those ACE inhibitors, that could be the cough. Slayton, Minnesota. Thank you, Slayton. Is there anything new in treating Meniere's disease? She suffered for it for 30 years. Meniere's. What's Meniere's?
Dizziness.
Dizziness. And it's associated with a hearing, and sometimes it's one side hearing loss, sometimes it's
Ringing in the ears, dizziness. When we say dizzy, we mean spinning, not balance, just walking poorly. I actually last month I sent poor gal that's been suffering from this for many years down to, she'd been to University of Minnesota, went down to University of Iowa, in hopes that they could try something different, but unfortunately there wasn't anything new at those 2 places. You treat them with sometimes zinc, sometimes a thiazide diuretic will help.
Scopolamine patch is one of the symptomatic treatments.
Yeah.
Makes your mouth dry, sleepy. How many people do you see who have this twirling, they roll over in bed, they get this benign positional vertigo, have the kind of thing that you can treat by moving them through one of those position maneuvers? Have you had that experience, and have you used that?
Use that, and if it just seems to be certain maneuvers that seem to be setting them off, usually send them physical therapy to get them through the training. How to do this, they can actually do it sometimes, and I tell them if they're doing it right and this is the cause, it'll get worse before it gets better as they're doing it.
Right. Go on the internet and look up Hall-Pike maneuver, and it has another couple other names. If you Google vertigo and you look for maneuvers and you learn it, it has to do with laying down, rolling on the side that causes you the worst trouble, and a slow rollover and waiting for this.
My brother-in-law was visiting me a year ago, and he'd had this episode going on for 3 months, and he had tried different medications, and so I put him through the maneuver.
And it worked.
And it worked, and the next day it was gone. So they really do work, so, you know, get some help.
Yeah, and actually, in some cases it doesn't. I mean, I've just tried it many times, and okay, well, that's not it. But sometimes it does. So it's really worth looking it up.
Right.
And you don't need to go to the doctor to do it, although your brother-in-law sure did, didn't he?
He owes me one.
Does he owe you a glass of wine or something like that? We have one from Flandreau. Caller is concerned about 60-year-old man whose calf muscles have shrunk, and he's having discomfort, especially with walking. He takes a daily aspirin, has recently stopped his statins, and is a little bit better. What do you think about statins as a cause for discomfort in the muscles, for one?
Very common that you see the statins, especially Lipitor seems to be one of the worst. They really seem to, Lipitor really drops your cholesterol quite a bit, but it also is one of the higher risk ones.
Well, and Crestor as well. I mean, you know, all of them, simvastatin as well. I've seen it. And you know, as well, you also see people who have memory issues with the statins. I mean, and as you get older, the older you are, the higher risk of side effects. But I wonder if this is the case. I mean, this guy has some shrunken calf muscles.
Yeah, I wouldn't jump on that either, because statins don't shrink your muscles, and they're not isolated muscle groups. They don't just hit the calf muscles. They tend to hit all the large muscles. So I would encourage you to go and see your physician. And
What do you suspect? What is a clue?
well, it could be circulation, because you need circulation to have good muscles, and when you walk, you don't get enough. And the other thing is a thing called a peripheral neuropathy, which could be doing this. So I wouldn't blame the statin on this one until you go and check with somebody.
I thought it was a good opportunity to pounce on statins, though, just for my personal point of view.
Enjoyment.
But I think that you know, back, I know, spinal stenosis could do this too. Some kind of neuropathy of some kind. 60 years of age is too early for a lot of things. The fact that it's worse with walking suggests claudication,
Right.
which is what again, Aaron?
Claudication is you're just lacking the blood flow with activity. Your muscles are not getting enough blood flow and oxygen with activity. Gets better with rest.
Yeah. But I suspect there's some weird neuropathy here.
Go out to a store, lean over a cart, walk around leaning over and see if it bothers, and then stand up and see if it bothers and continue to walk.
And what clue would that
Quite
be?
often the spinal stenosis is better if you can lean forward. You see those people walking at Walmart, lean on the cart walking. They can do better, but if you stand up and push the cart, it's worse. Then it's my leg pain worse.
So that's a good clue.
That's
a good walking clue.
You need to do that. Your back's been hurt.
Yeah, there you go. There you go.
We have a caller from Rapid City. Any home remedies for a urinary tract infection?
Good old cranberry juice and lots of water.
I also have been using a lot of, just like cranberry juice, is vitamin C, 500 or 1,000. And I have found that, you know, recurrent urinary tract infections in nursing homes are rampant. And I hate to go advancing antibiotics because pretty soon you have a resistant organism. So if they have a couple doses of infection, experiences with infection, I put them on 500 or 1,000 4 times a day, and the bladder infections go away. It acidifies the urine. Now there's some data that doesn't say it's that effective. In my experience, it has been very helpful. Your comment, any other?
I like your comment in my experience, because that's quite often you see in medicine. It's like, I don't care exactly what the data says. It's been working very well, so I'm not going to argue with results.
There you go. Sometimes the scientific data that you gather, it's
a good guide.
Yeah, it's a good guide, but
not the gospel.
There you have it. Edgemont, South Dakota. Talk about Raynaud's phenomenon. What can be done about it? That's a good one. Kim, Raynaud's.
Oh, Raynaud's. What it is you exposed to cold, your hands turn white, and then they get very frequently very painful. Afterwards, the body tries to compensate, and they get extra blood supply, and they turn either red or blue.
Or sequence of those.
Right, and you can have it with no other underlying disease, but if it's a persistent problem, you need to get looked at for things like lupus, a thing called vasculitis, sometimes rheumatoid arthritis. Cigarette smokers, we're going to nag that a lot tonight, I think, but that's a big aggravating factor too.
Well, there's a condition called Berger's disease, which I always think about when someone presents with Raynaud's and there's smokers, because it's just like an accelerated Raynaud's, only in smokers, and it goes away if you stop. Right. And who knows why it occurs? I mean, do you know? You know almost everything.
No, not in that.
Don't know that. But Raynaud's, you know, can be just 50% of it's just Raynaud's, and that's all it is. But you should look for lupus. Should look for rheumatoid arthritis, and certainly the treatment is either treatment of those diseases or keep your hands warm. I mean, you know, and the classic is going into the freezer, and they come out and their hands just turn different colors.
And it doesn't necessarily help to move south, because it's a temperature change from this warm to this cold. So if you're out here outside in Phoenix and you go to air conditioning, it alone can trigger it.
And so what's the cause of this?
Unknown.
So, I mean, it's one of those immune system things. What causes an immunological problem? Some people say it's because we weren't dirty enough as kids, and we were raised in a sterile environment. You've heard that.
Actually, I know somebody in the nursing profession that actually their fingers break open because it lacks so much blood supply. It vasoconstricts so much.
I've seen people's fingers pinched off. They've lost the blood supply to the tips of their fingers. Yep.
A couple of quick thoughts on treatment. There are some medications that are helpful, but occasionally people are taking medicines that make it worse. And so,
like what?
They're called beta blockers for heart disease and for high blood pressure.
And so the treatment, the better drug is the calcium channel blockers, right?
Correct. And so at least you need to talk to your doctor about it because it might be markedly improved by just a medication change.
Very good. We got just one room for one more. Wakanda, treatment for vertigo. We talked about it. Doctor, a couple weeks ago, mentioned best hand lotion to use. What is that? CeraVe, or any of them that have ceramide in it. I think amlactin therapeutic is one. But in our household, we have CeraVe at every washing basin and in the shower. CeraVe, C-E-R-A capital V-E, with ceramide in it. Kim, you have a comment.
Well, the greasier the better.
Yeah.
I mean, well, because lotions wash off or wipe off so easily, so the thicker, basically an ointment is better.
Yes.
So.
All right, we're moving on. 30 years ago, a young Nigerian named Emmanuel Onome received a pair of shoes from a missionary out of Wisconsin. Emmanuel, or Manny, wanted to pass that generosity to others, not only in his home country, but to the world. In 2003, he and his wife, Tracy, started Samaritan's Feet, a program that helps put shoes on the feet of families everywhere.
Our volunteers, as we're giving out shoes, we also wash the feet of our recipients and as a sign of servant leadership and humility.
Even more so than the shoes, it's just that chance to have a conversation and kind of build a little relationship with somebody. You know, as you're washing feet, it's very intimidating at first. Kind of, you know, once you dive into it and the first time you do it, you know, you become more comfortable with it. And you sit there and you talk with this person as you wash their feet and you give them a new pair of socks and a new pair of shoes. It just creates an opportunity to just pour into them and be an influence in their lives and tell them about Jesus. And there's people in your communities that are in need, and you don't need to go thousands of miles away to make a difference. You can do it in your communities.
We'll work with businesses, you know, that as a service project. We'll work with churches as outreach. One of the platforms, the most visible platforms we have, is called Barefoot Coaching. And so we have coaches around the country that'll use their platforms to help us raise funds and awareness, and then usually come up serving at our events. And that's what today is really about. Coach Stigemeyer has gone 2 years barefoot for us, and so he helped us raise funds this last year. Coach Nagy, Coach Frederick here at Brookings High. I mean, all of them have used their platforms to help raise the funds for the event today.
And thank you, Coach Nagy. Join our conversation and call in your questions or comments about, well, anything. Call 1-888-376-6225 or email us at questions@oncalltelevision.com. We have a caller from Del Rapids. Blood clot, right leg, 7 years on Coumadin. Is there anything else they can be doing? How serious is it? So let's talk about the danger of a blood clot in the leg. I mean, that's a significant problem, but I don't always, just a leg clot, I don't always treat with warfarin or Coumadin. What do you do?
Depends upon where the clot is. Are you talking about a deep system? Are you talking about a superficial system? What part of the leg is it in? It all makes a difference.
Yeah, I think if it's in the lower leg, 20% will go to the upper leg. When it's in the upper leg, 20% will flip to the lung. If it flips to the lung, 20% of them die. So I generally treat if it's in the upper leg for sure, and a deeper system. So you do treat with warfarin when it's higher. Kim, any comment?
No, I agree with that. I guess one of the critical issues, being on it for 7 years, most people you put it on for 3 months, 6 months, or a year, and then you discontinue it unless there's some underlying cause that makes you at high risk for recurrent blood clots.
Right, and I think a second blood clot would mean, okay, you're on it forever.
Right.
What else?
Well, trauma. I mean, if you've got a banged up leg and the vessels are damaged permanently, you might consider doing it. And then there's hereditary things.
A clotting factor problem.
Right. And I mean, if you got the blood clot as a young person, you need to get that looked into, because that would make you want to take it forever.
I kind of think that for the most part, though, one blood clot, anticoagulate for, I generally say 6 months, stop it, another blood clot, it's on forever. And you know, you can do these complicated workups, but they may miss it, or they may call for problems, and then you'd never have a problem. So I just wait for the second clot. Blood clot to the lung, do you anticoagulate them forever?
Again, for me, it's what caused it. If it's after a surgical procedure,
a knee surgery or hip surgery, yes, you would. No, you wouldn't.
I'd probably do it a year and then worry after the next surgery.
Yeah, after the next surgery. Or if they're a trucker and they had an accident and they've been if we have an explainable reason and that's gone away, okay, then we can stop it. But if there's no reason, you're more worried about it.
Business person that flies all the time. I fly all over the United States, or I go to China, and I'm on the plane for 13 hours. It's like, oh, you're high risk for just sitting there.
So
for a repeat.
Yeah, for a repeat. So anticoagulation. Certainly you anticoagulate people who have heart valves and atrial fib and other things, and they stay forever. What about the different kinds of blood clot medicines? I mean, say your honest take on that. I'll give you mine.
You fire first.
Well, no, okay, I would say I'm right now an old fuddy-duddy who likes to know exactly where they are. And it's a dangerous drug, any of them for anticoagulation, and this one is a time that I can monitor that they're actually taking it and see where they're at. And the new ones may be better in the long run later, but it's too early, I think. What do you?
And I'm exactly the same.
I agree completely. What scares me is that with the new medications, you can't reverse them if they come in bleeding. I mean, you're stuck with whatever bleeding episode is happening, whereas with the old warfarin or Coumadin, you can at least reverse it.
And they'll argue with you on that one, but I'm an old guy.
I'm with you.
And it's 4 times cheaper, even with all of the testing.
Yep.
And we can test them. That's it. Denver, Colorado, what can one do to make the process smoother when checking into a hospital? Oh, well, obviously, Aaron, you can answer that one.
Actually, just wrote an article on this. When you go
Really?
Yes, when you check in the hospital, things that you can do is have a list of your medications. Better yet, take all your meds with you.
Okay.
Because, I guess that one did get changed by my cardiologist, and it's by the ways. And so if you have your actual medications, it makes a huge difference.
So bring your medicines with you when you come to the hospital. Anything else? Bring your insurance cards if you have them. And actually, if you're ever sick and the ambulance arrives, they should be able to go into your refrigerator and find a list of all your meds and your medical problems. Have your problem list.
But now that we were forced to do the computer system, which we all love thoroughly.
Yeah, dearly.
You know, for us to take care of especially the older people that are on multiple medications, what we are trying to do is to print out for them their current problem list and a current list of their medicines, and they should carry it with them whenever they're traveling or, like you said, somewhere that the ambulance
can find if they
enough mistakes are made accidentally, but if you don't have all the information that you need to help somebody in the emergency room, it's just worse.
There you go.
Snowbirds.
Snowbirds. When you're traveling, you should have the latest information.
Yep.
Primarily the problem list and the drugs.
Right.
And allergies.
And allergies.
Rapid City, why are penicillins, why is pernicious anemia underdiagnosed? That's an interesting one. Aaron? Pernicious anemia.
Yeah, and so
goes with B12.
Yeah, and so there's different. I was always taught that if you're looking for one and you're thinking about anemia, you better be looking for pernicious anemia. But their MCV, which is a blood test, MCV is okay. Doesn't make a difference. What happens if they got a pernicious anemia and an iron deficiency anemia? One's make them big, one makes them small. They look normal in between.
Yeah.
So, I guess through the training, be looking for both.
I do B12s on a person at the drop of a hat. If they look at me wrong, I'll do it because you can have a long-term dementia associated with it. It's the first thing I do with thyroid when I'm looking for Alzheimer's disease. I'm out to make sure they don't have pernicious anemia. B12 deficiency is what it is. And to have an indication for B12, you have to have a sore tongue. And there is an epidemic of sore tongue in my town. Oh my gosh, that tongue looks awfully irritated. That's a joke. I check for B12.
Numbness in your feet, you know, this tingling, funny sensations.
Anybody who has a neuropathy, anybody out there with a numbness should have their B12s tested.
Absolutely.
When's the last time you found an abnormal one, though? Looking for that? For the feet?
Within the year.
Have you really? I have been looking, and I still keep looking.
I check B12s all the time, and I catch. Now here's the other thing: B12s can be artificially high, like a 300 or a 200, and if they have neuropathy, boy, they're on B12. Actually, I put them on B12. If anybody has numbness, they just automatically get on a B12 anyway, because I don't trust the blood test.
And you urinate it off if you get too much.
Doesn't hurt.
There you go.
Dirt cheap. Ovarian cancer, any new medications or treatments? Kim, you know the
I have
answer.
no clue. I'd have to pass on that one.
Aaron?
Don't know off the top of my head.
There's a lot. But that's not our bailiwick. We find it and we send it off to the people who know the very cutting edge stuff. And there's some changes, some really great new things. Most of it's hormonal though. Esteline, and the other thing is catch it early and cut it out.
There you go.
Esteline has Parkinson's, trouble with sore, stiff butt when standing up. What can I do for this? I was thinking it was butt when I stand up, but it isn't. It's a buttocks. Sore, stiff buttocks when I stand up. Has Parkinson's.
Boy, there's no quick answer to this one. I mean, if you have Parkinson's, you're probably hunched over. You probably already got a bad back from that. That goes to the buttocks. You got to go and see somebody for that. That's no quick answer.
Sounds like a radiation of pain maybe from the back.
Could be.
Totally unrelated maybe to the Parkinson's.
I have seen recently a dear friend who has Parkinson's disease and had the worst back spasm. Of course, he overdid it. But I think Parkinson's people have a penchant to go into spasm. And so they're at risk for that. I think the most important thing anybody with Parkinson's can do is stretch and move. They got to keep moving. They got to get all the joints moving. They got to be stretching. They got to be walking.
Just along that line, have you heard this Parkinsonism treatment through physical therapy? Have you heard about that?
Yeah, big movement or something.
Yeah, I think that's what it's called, big. And I didn't even read on it. Somebody wanted to be referred because they'd heard that it was really good. All I know is they came back and they seem to be doing better on it.
Well, I'm a believer in that, mainly because of balance issues. I mean, physical therapy will strengthen their muscles, and a big part of the problems with Parkinson's is their stinky balance.
Yeah.
And so part of therapy is balance training, strengthening.
Strengthening, balance training, moving.
Idea.
Yeah, stinky balance. That's a medical term. I haven't heard that lately, Kim.
Dorland's Dictionary?
I don't know how to spell it either.
So, anywhere between 3 and 10% of the population suffer from a throbbing, creeping, unscratchable itch in the legs. By day, their symptoms subside, but at night, their legs energize and want to leap into action, making for unfulfilling sleep. What is this malaise, and how do people cope with it?
Restless leg syndrome is a very miserable feeling that you get in your legs. When mine started, which started several years ago, it really started with just an uncontrollable feeling of my legs and them wanting to move but me not wanting them to move. Then it progresses into where you get this creepy, crawly feeling, and what goes, it's in the calves of the legs. And then it has progressed now within even the last 2 months. It has gotten so much worse for me. It's like electric shocks going through all the time. It's not a pain. It's just a very weird feeling, an awful sensation, and nothing can be done about it except activity will, but I don't want to walk all night. If you get up and walk around, or a hot shower sometimes will relieve it, or mild exercising during the day does help. Water aerobics did help it some, and walking does, and a little bit of biking. Any of it can't overdo. I realize that does not help. That kind of undoes, kind of whatever I have been doing. One day I can just think, man, I've been walking all day, so it's really going to hurt tonight, and it won't. The next day I can walk all day, and it does hurt. So kind of no rhyme or reason with it. Most of the time, the creepy crawling, the awful feeling is at night. Sometimes I get that moving sensation like in the car, Or like if I'm in an airplane, you know, and you know you cannot get up, and that's when you really want to move, and you can't get up and move, and then, and you know, your legs kind of go, whether you want them to or not. They just move around, kind of uncontrollable. Yes, for me, the restless leg syndrome, they start from the knee and go down the calf and down to the ankle. And to me, they're mostly in the back, in the thighs. I don't feel it here necessarily, but it's in here. And that's when I do, if I, like I say, I want to sit for a little while, then if I squeeze that and rub them both and do them both that way. But it is, to me, that's where it is mostly. It's in the calves. I don't see it in the front. It's in the calves, and it's from the knee down, never above the knees for me anyways. I hesitated getting prescription at first years ago because I didn't want to be tied into taking something every day, whether I needed it or not. I wanted to take it as I needed it, and now I can kind of tell to begin with, like right in the evening after our evening meal, I can kind of tell that, oh, this is going to be one of those nights. Then I can take one of my medication pills that I've gotten for the restless leg syndrome. Somehow I feel like it isn't always discussed in groups, when I'm in groups of people. They talk about all kinds of things, but I never really hear that, and I think they should be willing to talk about it and have others be aware that it is out there and that it does have a name. It's not just a miserable feeling. That it is, I'm so glad it has a name, that restless leg syndrome, and it's that, like I say, that's what I would suggest to the people, that they let others know and tell their doctor that they have it, because it is really something. It's not just made up in your mind. It is there.
We do appreciate her giving us the feedback of the restless leg syndrome, and of course some of the new Parkinson meds work for that. The old L-Dopa Cinemet we try to avoid. Here's a question from Sioux Falls. Discuss the symptoms of genital herpes. Would it cause sores all over the body?
Genital herpes is herpes virus. There's type 1, type 2. Generally say type 1 is on the face, type 2 is the genital one.
I mean, it's a cold sore.
But it's a cold sore,
a blister.
But it is a different type of herpes virus. Could it be everywhere? Well, if during sexual contact, yes, it could. It could be everywhere. We had one that the female had it all over her bottom. It was just,
everywhere.
There was probably about 100 lesions, and I tell people it's like taking a Brillo pad and rubbing it. So it's possible. Kind of unlikely, but possible.
What do you think about syphilis? Could that be syphilis?
All over?
No, it shouldn't be. I mean, they could ride together, though.
Yep.
If you have one sexually transmitted disease, you really need to be checked for all of them.
And most of the time they're treatable, although nowadays they're a lot less responsive to the old antibiotics that we have. Gary, South Dakota, had a crusty growth removed from the cheek. It's coming back now. Is that a problem?
Yes, it is. So you got to go and see your doctor, dermatologist, but somebody.
Yeah.
Another look.
It's a return.
Right.
It could be just an actinic. It could be just an age spot, but it could be, you're always worried about basal cell.
Return.
One of the cancers.
Yeah, or squamous cell, yeah. Freeman, amyloidosis, what is it? What's its treatments?
Unfortunately, I've had a couple of patients with amyloidosis, and the first thing is you have to find out the cause of it, because it can be caused by several different entities. Severe rheumatoid arthritis, autoimmune diseases, severe chronic inflammation. And then there's primary amyloidosis, which is just plain amyloidosis. And it's too much protein, a specific protein that's made by your body, and it deposits itself in bad places. Kidneys, blood vessels, brain, heart. It's a tough one. One of my patients ended up getting a bone marrow transplant for it, and she had to go out east for that, and she did very well with that for a number of years. And so,
is it because the patient had plasma cell leukemia?
Nope, she had primary amyloidosis, and they just did a complete bone marrow transplant,
and it got better.
Well, she eventually passed away from it, but I encourage you to pursue the routes.
Right. I had a patient in the brain. I had 2 cases of this, and they had orthostatic hypertension, hypotension. Their blood pressures dropped when they stood. so they couldn't stand easily. And I had a second case of that. Eastern South Dakota, what's the best medicine for women over 85 with bladder control issues? Should they be taking anything at all? Aaron.
First thing I'd be looking at is that area down there on females is very estrogen sensitive. So you've got to be asking yourself, if they're getting bladder control, is it because that tissue has shrunk down and they maybe need just some topical estrogen? Beyond that, there's pills and stuff, but if you can get that tissue more resilient so that it fights off bladder infections as well as help with bladder control.
Yep. And sometimes slings can help surgical things.
Yeah, and at least in our physical therapy department, they have some gals specially trained now to work with that, teach gals to do specialized muscles and exercise and do indeed improve it. So you've got multiple options.
50% get better if they learn to tighten the sphincter and relax it in something like 200 times a day. That's a lot of exercise.
The Kegel's just tough to teach to people, and so that's the biofeedback works really good if you're going to get it to work.
We got to move quick. Itchy rash all over. Been 4 different dermatologists without relief. What could it be, and what can she do for relief? 4 dermatologists and not success. I don't know that we're going to.
And you're talking to an internal medicine, family medicine here.
Yeah, you having a good answer?
I'm sorry.
Is there biopsies taken? You know, there's got to be.
I think the most common thing I tell people, and they have to be patient, is to really eliminate all of the soap and the hot water and don't wipe off their own normal flora and use CeraVe, C-E-R-A capital V-E.
Do you have investment in this or what?
No, I don't. So right after showering, put on CeraVe, and that's as good as you're going to get for a while.
Processed in your own backyard.
Yes, and I have so here from Sioux Falls, how does one get rid of floaters in the eye, and what medication helps?
Now that I have floaters, you just live with it, unless they significantly affect your vision. Then you go to the ophthalmologist. But if they're just an irritation,
you live with it.
You live with it.
Yeah, I had it, and it affected my vision, and I had it.
Lasered?
No, I mean, I had vitrectomy and scraping.
Oh, the whole thing.
Well, I was losing my central focus, you know. Wow. Explain Graves' disease. Aaron?
Oh, it's one of the thyroid diseases.
Yes.
Let's just put it that way.
Okay, Kim?
Well, it's technically an autoimmune disease where your body is attacking your own thyroid, and initially it turns it on. It makes the thyroid overly active, and then eventually, if it gets burned out, you go the other direction. But other things you can get with it is the bulging eyes, which sometimes really need some ophthalmological help with it. But
that's great. Aaron, any further comment on that?
When the patients come in, if they have prominent eyes, and I make a point, don't say bulging eyes, say prominent eyes, and I always ask them. I don't mean don't mean to be personal, but has anybody ever talked to you about your thyroid maybe and getting thyroid? I did pick up one that way.
I did too. Has had pain in the left heel, can't do a 2-mile walk, has 2 cortisone shots, and it didn't help. What is the next step for treatment? What has he got?
Probably plantar fasciitis.
Right, I think that's what it is. I mean, they've been
Depends upon what part of the heel, but if it's the classic kind of under, make sure you get some good arch supports more than anything else.
That's right. I think, and it isn't that there is calcification and a thing that you go in surgically. The problem is arch supports. So
you got to distribute that weight all the way across the arch.
Good man. Mapleton, Iowa. Caller has a lab test. She doesn't understand. MCI. I don't look at MCI. I look at the MCV. It tells you the size of the cell. MCI, I don't know what it's borderline. She's got eosinophilia and basophilia that's a little elevated. What does that mean, and what do you take from that?
I repeat the test more than anything, to be honest with you, because it can be due to various things. Eosinophilia can be parasites. It could be due to an allergic reaction, numerous causes.
Right. What it is it's if you look at all your white cells, the white cells are different kinds. Most of them are one particular kind, but when you see eosinophils, they're filled with little red particles, and they go up with parasites and allergies. Basophils are kind of a chronic inflammation cell, and it's generally not a dangerous thing. We just kind of watch it. You say,
agreed.
Brookings, in the night, wake up, urinate, and then hip and leg hurts, and then it goes away after they urinate.
See Dr. Holm tomorrow. Sorry.
I don't know. My sense is that it has to do with getting up and moving around.
I agree with you.
I get
Is this gentleman, did they say how old?
No, doesn't. It's a man.
Yeah.
Here is from somewhere. Discuss trench foot is what he meant. What about trench foot?
Have you seen cases?
Well,
of the World War?
back when there were still World War II vets around that were out in the wild, they frequently came back with trench foot. And it was from wearing the shoes, never changing them, having them wet, and you know how your skin gets soft and mushy when you're in a bathtub too long? Well, imagine doing that for days on end. And they crack open and they start to get fungus, and it leaves permanent damage to the blood vessels, to the nerves, and it's a lifelong problem if you truly have had trench foot.
Yeah, my sense is they get deep set fungal infections that you cannot get rid of. How can caller get rid of ringing in the ears? My ears, nose, and throat specialist says turn on the radio, turn it to off a channel so you have this kind of background sound, and that's a pretty cheap way, or you can buy a wave machine so you have this background sound.
First of all, you want to make sure that is it one ear, both ears? Both ears is generally in medicine is a better thing generally. One ear, then you get concerned, was there damage due to a shotgun going off, or is there something else going in there, acoustic neuroma, something like that.
Wise words.
So
Dr.
get them. What I do is I send them, get them tested, and then they help teach them. Here are the sound canceling things that we can help teach you.
Which is basically the radio off channel, kind of a background. Drives some people crazy. I think it comes and goes. If you just kind of be patient and get your mind on something else, it'll go away. Lennox, sweaty hands, what can be done medically? A lot of people will have sweaty hands.
Hyperhidrosis.
Yes.
Hyperhidrosis means I have too much sweat, basically. There's some medication called Drysol that you can put on them if you want. In the really tough cases, we talk about hands, but I've had some people on their back, so it looks like their pants are wetting their pants behind because they sweat so much. And you can try Drysol, but otherwise you can do some injections also. I believe they use Botox to use some of those to help take care of the problem for 3 months at a time.
Yeah, really. Take home messages. Wessington Springs, Baker's cyst on the back of the knee. What causes it? What's the treatment? Quick.
Arthritis, you've worn out the joint, you're swelling, and it's got to bulge somewhere, so it bulges out the back. Lay off the activity that brings it on, and if it hurts you, go see your orthopedic guy. Or
sometimes you need to just get the knee fixed because it's a bad sign. Belle Fouche, caller has been on OxyContin and oxycodone since 2009 for back injury. Is it bad to be on pain medicine for that long? Ooh, we both all sigh, don't we? It is bad.
You try and get people off of medications. There are some people that need the medication, yes. If we can try and get you down on something else, do physical therapy, maybe surgery, maybe injections, there's everything else that you try. There are some people
who need to be
on it, and you work around them.
Gabapentin is underused. We could sometimes get people on the...
Yeah, you should be on something else besides that, most likely. I mean, I hate to say that just as a harsh statement, but there's other good things too.
Right. As long as it's not abusive and they're in a steady state, you know, people live a full normal life, sometimes just on a low-grade narcotic. It's different than they're on speed, which can cause some problems, or when they're on downers, which can cause deterioration. Both of those deteriorate. Narcotics they just do fine. Rapid City, diabetic glucose hit 200 on meds, but diet and exercise down to 90. Can I quit the meds, strict diet, and 3 hours of exercise?
Can we get rid of the diabetes? Number one, no, you will have the diabetes forever. Can I maybe, if I diet and exercise, get rid of my medications? Well, I tell mine, your metformin that you have, you will stay on it. I don't care what your blood sugar is, unless you're having problems, you'll stay on that forever. But everything else, maybe. And the big thing is you're going to push that down the road, your complications, because the diabetes is a progressive disease.
All right. So we're going to answer these questions that we didn't get to. We got a lot of them. Thank you. And we'll do that if you go online later. But we want a take-home message, you guys. We got a few minutes, or a minute. Take-home message you want to make sure everybody has, Kim.
Well, the take-home message I came down here with was for our senior citizens, that I strongly encourage you. 2 things. Talk with your kids about what you want done at the end of life under certain situations, and get a power of attorney established. It puts your kids in such a predicament if suddenly something happens and they don't know what you want to have done. So please start the conversation.
I'll throw this one at you. If there's a chance that, a significant chance that you'll never, it looks like you're never going to wake up again and you'll be in a vegetative state, would you want me to put you on a feeding tube? I mean, that's the question I would have.
That's a perfect example.
That's the question that you should have your kids answer to your kids. Yeah.
Well, just this morning I had that conversation with a family, and I mean, it takes extraordinary courage for a family member to turn something off.
Yeah. Aaron, any take-home message?
I ditto with him. Try and make the visit to the doctor and the visit to the hospital. Get your medications, know your diseases, bring that information in. Don't second guess. Don't try to remember, because everybody, I don't care what your age, you're not going to remember.
All right. These are great take-home messages. We'll be back right after this.
As your baby grows, there are new surprises and adventures every day. With each new milestone, remember, immunizations are safe and one of the best ways to protect against serious diseases, especially between birth and age 5.
Now that my grandson Henry has reached his first birthday and our granddaughter Stella has arrived, we're making sure that they stay on their immunization schedules.
Schedule your children's immunizations today, for baby's sake.
When reading about how health care is provided throughout the world, one often hears the word disparity. Coming from the Latin word paritas and related to the word parity, both meaning equal and balanced, disparity emphasizes the imbalance of things. Take, for example, how healthcare in the U.S. is too often excessive, unnecessary, and wasteful. And yet in developing countries, it is too often inadequate, desperately needed, and underfunded. In the United States, we spend more than $8,000 per person per year for health care, and too much of this is from repetitive, unneeded tests, defensive medicine, unproven surgical or medical intervention, inflated pharmaceutical costs, polypharmacy, outright fraud, or, last but not least, bureaucratic oversight. Of the $2.5 trillion spent annually in the U.S. for health care, it's estimated that 20 to 40% is simply wasted. Money down the toilet for care that doesn't enhance health or decrease suffering. I should add here that, in my opinion, getting a handle on this problem has not and will not be changed just by adding more bureaucratic oversight, but that's another story. The point is that too much of the cost for health care in the U.S. is wasted and adds nothing to our health. Now for the disparity. In many developing countries, there is a tremendous need for cost-effective health care that goes unfunded. Although cell phones and iPads seem to have found their way throughout the world, simple healthcare technologies have not reached many who need and deserve them. And although HIV/AIDS, TB, and malaria treatment and prevention have recently received some important funding, still, inexpensive and yet effective tools for monitoring and treating common basic medical conditions are left unavailable. Hypertension, diabetes, and cervical cancer are perfect examples of how minimal resources could help diagnose and treat such conditions, saving lives and preventing suffering. Simple, not so expensive, and yet effective healthcare is too often not happening in the developing world. What's more, in those poorer countries at the end of life, too often there is no appropriate pain medicine to provide comfort during the dying process. It is disgusting to think of the cost and excesses going on here, and yet many people in the world without even the basics. This is disparity. This brings us to the end of our show this evening. I sincerely thank our good friends and guests, Doctors Aaron Shives and Kim Wilde, for helping answer our audience questions this evening. As often happens, we aren't able to get to all the great questions, so join us now on the website, oncalltelevision.com, to see answers to the questions we didn't get to. We'll be live on the web in just a few minutes. Marlo Thomas, daughter of entertainer Danny Thomas, tells us laughter completely engages the body and releases the mind. It connects us to others, and that in itself has a healing effect. We need to laugh more. Until next time, stay healthy out there, people.
Funding for On-Call Television is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On-Call Television as it continues to open doors for important medical information.
and by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding is provided by Dakota Care, Brookings Health System, Dakota Allergy and Asthma, Dakota Dermatology, Aberdeen Asthma and Allergy, the Orthopedic Institute, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, Brookings Health System, and Fishback Financial Corporation.